All right, so my name is Benjamin Wynn. I'm a student nurse here at the College of Nursing. You can go ahead and scan the room. Here's my ID. All right, so the first thing I'm gonna do is just verbalize that this is a no interruption zone, no text messages, no phone calls, anything like that. The next thing you're gonna do is come and verify your order on your MAR and your chart. So it's here that you're gonna identify the 5 rights. So this is Jaguar J. Jones, Heparin, 5,000 units, subcutaneously, every 12 hours, every 12 hours. After you do that, you are going to assess the allergies using the same 2 sheets. So allergies, penicillin. After you do that, you're gonna perform hand hygiene. You're gonna grab your medication. For me, it is heparin. All right. So then you're going to compare the label to the MAR. So this is heparin 10,000 units. My order is heparin 5,000 units. So I'm going to be using half a milliliter, 0.5 milliliters of the medication. Now I'm going to check the expiration date, December 5th, 2025. So it's not expired, it's good. Then I'm going to re-verify the time. So it's been 12 hours since the last injection. Today I'm going to be using my 1 milliliter TV syringe. So after that, I'm going to clean the top of my vial. Card. I'm going to grab my syringe. Just cut this. I'm going to draw out half a milliliter of air. Inject. I'm going to expel that half a milliliter of air. Then I'm going to draw out half a milliliter of heparin. So for heparin, you do not want to expel the air bubbles, so I will not be doing that. So I'll use the scooping method to recap my syringe. All right, so after I do that, I'm going to come back to my MAR. So I had heparin 10,000 units per milliliter. My order was 5,000 units. So I drew out half a milliliter into my syringe. So after I do that, I'm going to go verify my medication order with another nurse as well as my calculations. I'm going to come back. I'm going to do my second verification of 5 rights. So Jaguar J. Jones, Heparin, 5,000 units, subcutaneously, every 12 hours. After I do that, I'm going to create a label for my syringe. So on this label, I'm going to put the patient's name, the medication, the dose, and I'm going to initial it. Right. Should do that. Attach it to the syringe. You're ready to enter the patient's room. How you doing, Mr. Jones? I'm going to perform hand hygiene. I'm going to identify my patient using at least 2 identifiers. So I'm going to compare his armband to my MAR. So this is Jaguar J. Jones. His date of birth is 08/25/1963. 08/25/1963. His MR number is 417-6352. After I do that, I'm going to assess for allergies. I'm going to look at his allergy band. So he's allergic to penicillin. So Mr. Jones, I see that you're allergic to penicillin. Luckily today, we're not going to be administering any. If you have any other allergies that we aren't aware of, please just let us know. And for heparin, that you must do pre-administration assessments. You're looking for things that may contradict the effects of heparin. So these are going to be things like cerebral or aortic hemorrhages, gastric ulcers, recent childbirth, so things like that. So after you do that, you're going to do your last check of your rights. So this is Jaguar J. Jones, heparin, 5,000 units, subcutaneously, every 12 hours. After that, you're going to explain the procedure to the patient. So Mr. Jones, I'm going to be administering heparin subcutaneously on your abdomen. It's going to be a quick little procedure, should be over in no time. So after I do that, I'm going to lower or raise the bed to a good working height. I'm going to lower the side rail, and then I'm going to apply my clean gloves and goggles. So the most suitable site for this, for a subcutaneous injection, is going to be the abdomen. You're going to want to get it within that 2-inch margin around the umbilicus. You don't want to go below the groin or pubic region, past the anterior and superior iliac spines, or above the costal margins. So after you do that, you're going to clean the injection site. You're going to go in a circular motion. You're going to start in the middle, go outwards. All right. Now I'm going to administer my heparin. Alright, so this is a subcutaneous shot, so you're going to pinch the skin. You're going to go in at a 90-degree angle. And then you're going to administer the shot slowly. Alright, so you're going to pull it out. You're going to apply pressure, but you're going to make sure you don't rub or massage. You're going to dispose of the syringe into the proper sharps container. So after you do that, you're going to lower or raise the bed back to its original position. You're going to position the patient comfortably. Before you do that, then you're going to position the bed again. Then you raise the side rail. You're going to take off your gloves and goggles. You're going to perform hand hygiene. As you're doing that, you're going to assess the patient for any allergic reactions. You are going to go document the patient's response on the MAR. This is going to be your 6th right. And then after that, you're going to reassess the patient as indicated or needed.